I launched Simply Vital Health in the most basic sense is because I, as a hospital administrator, needed our platform and I couldn't find it. So I said I might as well create it. We focus at this point specifically on bundled payments, and if you have followed value-based care, and if you're looking at the different products in value-based care market, you see that bundled payments are poised for the largest growth. Despite what's happening at the federal government level, a lot of the analyses that we did, conversations with private health insurance companies, is this is the direction that we're going. And so what we do is we bridge the gap between providers and different clinical affiliations. So as the patient moves from the hospital to post-acute care to home, we make sure that all of the providers that are working with that patient are working together. Now, there's a much larger vision of what we're doing. We're using a technology called blockchain, and at the most basic sense, blockchain is just an immutable record, which means that as information hits that chain, it can't be deleted or changed. There's a lot of applications for this, but what we notice is that as we as a company start to build more applications on this technology, we need to make sure that it's safely adoptable by healthcare. So we're creating a healthcare grade blockchain protocol. So blockchain in healthcare is really, really exciting. And what we see in the long term is there's a lot of potential for blockchain technology. You'll hear a lot of people say we should put all of our electronic medical records on the blockchain. Not a good idea. It's not a good data storage, but there are a lot of other things that you can do with it. I think what's really important with blockchain is that we start with very practical implementations of the technology. So you'll start to see things like what we're using it for, which is an audit trail. Very simple, immutable audit trail, which is important in value-based care because you have to prove that you work together. Providers have to prove that they work together. Moving on from there, you can use what's called a smart contract to release healthcare distribution, healthcare payments. And so there's a lot of applications to build on it over time. But I think practical, simple implementations are what will get us to the much larger vision of the technology. So it's interesting because I've had experience on the clinical side as a hospital administrator and then now on the digital health side. And the genders that I interacted with are completely different, and part of what I'm going to speak about tonight. So what I would ask as a female CEO is that those of us that are working in healthcare, especially those on the clinical side, keep pushing for those leadership positions. We need more women at the executive level, more women in senior VP level, C-suite level, because we're seeing a shift in digital health and entrepreneurship, but when we start to approach potential customers and clients, conversations happen when genders are more balanced at that table. So I would say keep pushing for those leadership positions. We're going to get there. I think just kind of keep pushing more towards those levels and that leadership level.